Today we will know about the liver. How the liver works. The liver is about 1 kilogram weight. The liver is a complex chemical factory that works 24 hours a day. It processes virtually everything you eat, you drink, you breathe in or rub in your skin, and that's just some of its over 500 different functions vital to life. Every day, your liver helps your body by providing it with energy, fighting off infection and toxins, help clot the blood, regulating hormones, and much more. To give you an idea of the liver's critical roles, here is a partial list of functions. The partial list of functions is a metabolism, alcohol and other drugs and chemicals, neutralizing and destroying poisoning substances, and cleans the blood, producing, storing and supplying quick energy, just like a glucose, to keep the mind alert and the body active. Processing, storing and exporting fat. Transporting substances in the blood, clear the clots of the blood, providing resistance of infection. What's regular the balance of the hormones? It cleans sex hormones, thyroid hormones, cortisol and all adrenal hormones. Product cholesterol accept and convert to the essential substances. The liver is the most valuable part in our body. Now let's see how liver functions and what disease you can get it. The liver is the main function is the liver filters cells, process the blood as the circulates through the body. It metabolizes nutrients, detoxification, harmful substances, makes a blood clotting protein, and perform many other vital functions. The liver makes protein. The cell in the liver contains protein they call enzymes that drives this chemical reaction. The liver enzyme test, formerly called liver function test, which doctor prescribed. LFT, that means liver function test. The test will be done as inflammation damage to the liver. They can also check how well the liver is working. Liver enzyme testing. The test includes ALT, AST, alkaline phosphates. Liver function test is prothrombin, international ratio time, albumin and bilirubin. And doctor will decide which disease the patient got it. Suppose you're drinking, so you can have a cirrhosis liver. This is damage, complete liver damage. Cirrhosis liver belongs to the alcohol. If you drink a lot of alcohol, you have a cirrhosis liver. A liver transplant is a surgical procedure to remove a diseased liver and replace it with a healthy liver from a donor. Most liver transplant operations use liver from deceased donor. Through a liver may also come from a living donor. The liver transplantation or hepatic transplantation is the replacement of the deceased liver with some or all of a healthy liver from another person, called allograft. The most common used technique is orthopic transplant, in which the native liver is removed and replaced by the donor organ in the same anatomic location as the original liver. Liver transplantation is a viable treatment option for end-age liver disease and acute liver failure. Typically, 3 surgeons and 2 anesthesiologists are involved, with up to 4 supporting nurses. The surgical procedure is very demanding and ranges from 4 to 18 hours depending on outcome numbers. It depends on anesthesia, called anastomosis, and suture, and more disconnection and reconnection of the abdominal and hepatic tissue must be made for the transplant to succeed, requiring an eligible recipient and well-calibrated liver or cadaveric donor match. The first human liver transplant was performed by Dr. Thomas Tate in 1963 by a surgical team which is Denver, Colorado, United States. Dr. Starch performed several additional transplants over the next few years before the first short-term success was achieved in 1967 with the first 1 year survival post-transplant. That means the liver transplant was started in 1963 by Dr. Thomas Starch. How the liver transplant physician or surgeon does and what technique they use for the transplant. The donor's blood in the liver will be replaced by an ice-cold organ storage such as Viaspan, ultra-Viaspan, until the allograft liver is inflammation involves anastomosis connection of the interfere vena cava, portal vein and hepatic artery. After the blood flows is restored the new liver, the biliary anastomic is conducted either to the recipient on bile duct or the small intestine. The surgery usually takes between 5 and 6 hours but may be long or short due to the difficult operation and the experience of the surgeon. The large majority of liver transplant is to entire liver from non-liver donor to the transplant. Particularly the adult recipient, a major advance in pediatric liver transplantation was the developed or reduced size liver transplantation, in which portion of the adult liver is used for infant or small child. Further development, the area includes the split liver transplantation, and which one of the liver used for transplantation to replacement, and live donor live transplantation, in which is portion of the healthy person liver is removed and used as a allograft. Living donor liver transplant for pediatric recipient involves removal approximately 20% of the segmented. The liver donor must be being in a good health, having a blood type that matches or compared with the recipient, although some centers, having a charitable desire of donation without financial motivation. The liver donor must be between age of 18 and 60 years old, being a similar or bigger size than the recipients. Before or become a living donor, the donor must be undergo testing to ensure that the individual is physically fit. Sometimes CAT scan or MRIs are done to meet the liver. In most cases, the work up is done in 2-3 weeks. You might get complications. Living donor surgery is done at a major center. Very few individuals require blood transfusion during the surgery. All potential donors should know their 0.0 to 1% chance of death. Other risk of donation is liver include bleeding, infection, painful insection, and possibly blood clots and prolonged recovery. The vast majority of donors enjoy complete and full recovery within 2-3 months. And this is the liver function, how liver works, and how liver transplants replace. This is Dr. Nick Jadeja, MD, MS, AACP, United States, Boston. Thank you.